Hi, my name is Abby, and today I will be discussing my rhetorical analysis on my two infographics. And when first making them, I decided to use my audience for my technical instructions as my inspiration, some might say, in which the audience for my technical instructions was to teach those going into nursing school how to measure blood pressure using an aneroid sphygmomanometer, also known as a blood pressure monitor or cuff. So for my first infographic, I decided to cater more towards the general public for those who may be unfamiliar with blood pressure, specifically those who may be concerned with their own blood pressure and health-related diseases such as cardiovascular or kidney diseases. Um, as for my second infographic, I decided to use the same audience as my technical instructions. Um, so again, those going into nursing school where learning how to manually take blood pressure is a required skill. And so the differences between the two infographics is that, again, the first is much more general because the audience is very new to this topic. Whereas the second, because they're going into nursing school, they are much more experienced and have much more knowledge on the topic. At this point, they have most likely had some clinical hours or experiences with shadowing or volunteering in the health field. Um, and so, because of these differences in experience and knowledge, I believe for the first audience, they have much more general needs. I try to fulfill a much more general knowledge on blood pressure and how it specifically affects the audience. Um, so generally, I believe that the audience would value transparency, and simplicity much more. So as you can see, I include some definitions such as what blood pressure is, and I specifically focus on what hypertension is and how that can specifically affect the audience with these risks and also how many people are affected globally, annually, and some steps going forward. And so I create it much more, again, generally, and it's very simple. I try to use short blurbs and I try to use some lay terms so as to not overwhelm the audience. Because things such as heart disease, stroke, kidney failure, and damaged blood vessels can be very scary things for those who either have never had personal experience or they've seen it secondhand, how it can affect other people. Um, but as for my second um, infographic, it's much more specific. There are much more specific needs as the goal is to have the audience apply their already learned knowledge to help the previously mentioned audience by performing the procedure discussed. And so I believe they would value specifics as to help for some better performance. And so in it, I try to include much more specific and knowledgeable information, and I use medical terminology with the expectation that the audience already knows this jargon. Um, and so I also include some more specific statistics, while as you can see at the bottom here, I include an assessment chart, which those who are in the health related field would better understand how to read this assessment chart and also the significance of said assessments. Whereas for the more general first infographic, the only statistics I really include are generally what the audience should look out for in their blood pressure, and also that statistic here of how many people are affected, and that's more to gauge the interests of said audience. Um, and so I kind of had it so that both infographics were related to each other as the audiences have a direct relationship with each other. Again, the first being those who might be concerned with blood pressure, and I end it here. How to manage, talk to your doctor, and check your blood pressure. And so the audience for my second infographic would then be that those who would check the blood pressure for those who are concerned. And those are my infographics. Thank you.